How you doing? I'm a 54-year-old man, played some hockey, ran a lot, and really tore up my knee. Had multiple arthroscopic surgeries, no cartilage left over. My only choice is to have a total knee replacement. So I searched the internet. It was difficult to find normal people that had any instructionals to help people with rehabs post-op. So I'm going to make one, and hopefully it'll help you. Tomorrow's my surgery, and the journey begins. Successful total knee surgery on my right knee. It's covered with a Silverline dressing. This will stay dry. I can shower in it, and it's activated by normal saline sprayed on the silver lining on side, and that helps speed healing the process of the scar. So this is day one. Yesterday I had my total knee surgery. Used a lot of ice. Make sure you use ice. Follow your doctor's orders for whatever medications are best for you. And let's see how we do walking. I don't need a walker. Day one. It's day three. I kind of pushed it a little hard yesterday, and it felt great because there wasn't much swelling. But because I was up moving around so much, it really added to that extra fluid in my leg. So my advice to you is that first couple of days, just relax, take the doctor's advice. I tried to push it a little more than I should have, but I still feel pretty good today. I've been doing my exercises that my physical therapist has given me, and basically they're movement exercises in order to keep the joint flexing and extending. But on day three, it's feeling a little bit better. I'm trying to cut down on my Vicodin, and I'm using a lot of ice. So make sure you have a lot of ice packs, a lot of frozen corn, frozen peas, so that you can rotate those out 3-4 times. Okay, this is day four. It's buckled quite a bit around the dressing. I've been doing a lot of flexing. I've been doing a lot of icing. Continue the icing, push the icing. The swelling is a little more than usual, about a good 2 to 3 plus, but that's what's probably hindering a lot of the movement. Stay on the stool softeners. Fiber. You know, I use coffee, but I don't normally take this much Vicodin, so constipation can be a problem. Stay on the stool softening routine. All right, now the ice time. Okay, I've got it wrapped now. I work my way up when I ice, so I'm going to ice my calf and my shin, and some of my ankle I did a little bit, and then I'll work my way up to the knee and into the thigh, trying to move that fluid back into my system. The pain, totally bearable. Fear of pain, you know, post-operatively before you have this surgery. I had a lot of fear, ambulation, and all my difficulties, but let me tell you, this has by far been probably one of the best operations I've ever had. My pain is controllable. Stay on top of it. As much as I don't like taking the narcotics, the Vicodin is necessary. I'm cutting down every 5 hours, doing Celebrex and aspirin, making sure I do some soft massages to prevent any DVTs. I don't want any deep vein thromboses. So I'm doing a lot of self massage work, and ice, and walk, and work out, and watch horrible movies. But anyways, I wanted to make this tape because it was difficult for me to find something when I had my surgery that would help answer some of my questions. So I hope this helps someone. Thanks. There's a couple of Okay, this is day 5. I've gotten my dressing off, and the wound is healing nicely. I'm going to leave it open to air unless there's any drainage. And if there is drainage, then I'll just put another dressing on it. Sometimes with this much edema, you can expect some drainage. That's my only problem. If you see down here, I have like about 1 or 2 plus pitting edema. And that's about my biggest issue is icing. You have to just ice and keep that leg elevated for as much as possible, but the pain is minimal, and it just feels swollen. All right, I start every one of my workouts the same. I do 10 gluteal presses, and I press my glute and the back of my knee deep into the couch. Tighten that, hold that for 10 seconds. Meanwhile, I'm always waving my foot back and forth, not side to side, back and forth, just work with the logistics of the mechanics of the knee. Okay, after that, I'm going to do 10 leg lifts, hold for 10 seconds, keeping this point of my leg as flat as possible and bringing my toes to my knee tight. Hold that for 10 seconds. I'm going to drop that down. Then I'll bring it up. That's the hard part. It's still swollen. And I hold the flex for about 10 seconds. All right, then I'll go back, straighten it out, let it relax for 10 seconds, then start that whole routine over. That's just my couch routine that I'm doing right now. And I just finished, so I'm going to start icing. Okay, we're 1 week out, 7 days ago. The biggest obstacle continues to be the swelling. So I still recommend lots of walking. I may have overdid it the other day and walked a little too much. I'm giving a little bit of a back calf pain, almost like I pulled the calf muscle, but I kind of worked through it. You have to know the difference between injury pain and just typical muscle pain that's going to go hand in hand with this procedure. But so far, I've cut back on my pain pills. I'm taking about a half of a Vicodin 7.5 every 5 to 6 hours. I take a full one at night to help me get a night's rest, but I'm even going to try and cut back on that. So far, the exercises are working great, and I'll keep you posted. This is day 8 post-op. Doing good. Just still swelling. Swelling's going to probably be the biggest issue, as I've always said. A lot of pain when you first get up after icing or resting. You go down like a sleeping arm or foot or something, only like 10 times worse. I find that if you take your weight off that leg and bend it, that seems to alleviate it a lot quicker. Other than that, doing workouts and a lot of walking, frequent icing. We are at day 11 post-op, and it's doing good. The swelling is still an issue. It's starting to go down, but still at the surgical site, swelling is still a major issue. It's also very sensitive as far as the incision is concerned. So I have a wrap that I wear up here when it's just a cotton soft, plenty of room. That way, any pants that rub on that incision, they're not really as irritating. Other than that, lots of walking. That's the main thing. Still, try and cut down on your salt intake. There's going to be a lot of swelling. And make sure, once again, you need to have that Colace. You need to get a bowel program going because those narcotics are pretty rough on you. Day 17, it's healing up really nice. So chronic walks, but the big issues that you really have to look for is it still maintains a lot of tightness, surrounding the entire joint. I can walk for a mile, the joint feels great, but it's the surrounding tissue that's still a little swollen. Sleeping is an issue. Make sure that you set up a nice little sleep foundation. I have like a little bean bag that I kind of put my leg in at night. I ice and take my meds, and I usually get a good 4 hours, and that's about it. If you have any ideas for better positioning, please feel free to text me or email me. But right now it's working great, and keep you going. Here we are, surgical day 19, healing well. That's just a little bit of sunscreen. I'm going to continue my exercises. The exercises are pretty basic. Essentially, I do reps of 10. I'll start off with a 10-second ab hold. Hold that for 10 seconds. Do 10 reps with a little pump. Then I plant my heel, and I'm trying to straighten, and I'll usually have a towel right here, and straighten my leg so that I get a 0 flexion at that point. The next one, 10 seconds stretch, another 8 seconds a little deeper, and then I pull back and give a little hamstring pull and lift my leg up, pulling the toe, giving me a nice stretch in the hammy, and lots of walking. Okay, this is day 30. Still having some issues with some swelling. A lot of stretching, just chronically stretching, same stretching exercises, but day 30, doing lots of walks, about 2 miles, 3 times a day. Stick with it. Okay, the 5-week mark. Doing really good. Just make sure you set a schedule for your daily aerobics. I'm walking a lot, stretching a lot. Make sure you do your specific stretch routines, whatever your physical therapist works for you. But the most important advice I can give you is getting the best aerobic shape you can before the surgery. Whether you're riding a bike, swimming, walking, whatever, that's going to help improve your rehab when you're through and at this point. So give you another check-in, one more week at the 6-week mark. 6 weeks. Doing really well. Just got done with about a 1.5 mile walk, and then I do about 5 minutes on my bike. I just have my bike up on a stand. I like my Voodoo. I wear my Phytons for magnets, my Tommy Copper. It's all about changing your ions, more positive, negative ions, providing more a better environment for circulation. Blah blah blah. Whatever. This is week 6. Doing really, really well. Still have issues sleeping at night. That's difficult. A little lateral tightness. It feels like the joint is just trying to settle into position so that it will finally, eventually fade away. It's getting better every day. It's annoyance. It's not pain. It's just you're going to have a constant annoyance. It's as if you ace wrapped your leg a little too tight all day and you went home and took it off, and that feeling that you have, it's not painful, it's just distracting. Anyways, attitude is the biggest thing. Many mornings wake up, I don't want to do anything, I'd rather watch SpongeBob, but I motivate myself. I get on up, I get into my routine. I walk once in the morning. I do some stretches prior to my walk. When I come back, I'm starting to do 5 minutes on my bike now. I have my pool, which I do about 10 minutes of pool therapy. All I'm doing is walking back and forth, and some kicking and some flexion extension movements underwater. Feeling really well, cutting my meds down, taking still ibuprofen just because I have a lot of other issues with shoulders and whatnot, but ibuprofen about every 4 to 6 hours and an occasional half of a 7.5 Vicodin. Doing really well. Keep up the good work, and week 7's around the corner. I'm planning on going back to work week 8. Let's see if I stay on track. Okay, week 7. 7 weeks. Still some issues with some swelling laterally. Mornings are the worst. Need a lot of stretching, but keep doing what you're doing. A lot of walking, and that's exactly what I'm going to do right now. Go do another 2-mile walk. Here we are at 4 months. 4 months. I went back to work about a month ago. The only issues I really have now are when I'm sedentary, when I'm sitting still, I tighten up, so I find that I have to keep moving. The more I move, the better my knee feels. I still ice, recommend ice whenever it's convenient for you, but I go for 20 minutes about a couple times a week. Have not taken any ibuprofen or any other pain medicines. I feel 100%, and I hope everything works as well for you as it did for me, and I hope somehow this might help someone in some way in a little bit. Thank you.